A 70-year-old man recently approached me feeling frustrated, ashamed, and bewildered. He stated, "Doctor, I don't get it. I eat healthily and walk every day, yet when it's time to be intimate, nothing works." What I discovered was astonishing, even to me. His long-standing personal habit had been gradually restricting blood flow to his penis. This didn't happen suddenly, but rather slowly over the years. I'm Dr. Mohit Kara, a urologist and men's health specialist with over 60 years of experience in understanding what keeps older men strong, active, and sexually fulfilled. Many men believe that masturbation is harmless, but after 60, typical habits can silently damage nerves, narrow blood vessels, and impair sexual function without any awareness of the cause. In this video, I will reveal 4 secrets about masturbation that can gradually weaken your circulation and harm your sexual health. Additionally, I will provide you with safer, more effective methods to safeguard your well-being. The first secret alone is something that 90% of older men engage in, making it a significant contributor to unnoticed vascular deterioration. Let's get started. If you find this information enlightening, please subscribe and activate notifications, ensuring you don't miss any health tips aimed at helping you remain strong, intimate, and independent after 60. If you're with me, please show your support by commenting a 1 or a 0 if you believe I can improve. Your feedback is invaluable. Now let's explore the first secret, which is crucial. It's a common habit that is often overlooked, quietly cutting off blood flow to the penis for millions of older men each day. I refer to it as the death grip. Secret 1, the death grip. How excessive pressure is harming your sensitivity and blood flow. This mistake is prevalent among older men and extremely damaging. Men seldom discuss it with friends or mention it in my office, but when the door closes and they open up, this habit is revealed, applying too much pressure while masturbating. The term death grip might seem innocuous or even amusing, but the reality is serious. This practice is gradually damaging the blood vessels that sustain your manhood. Over time, a tight grip leads to more than just overstimulation of nerves. It compresses and injures the tiny blood vessels within your penis. These delicate vessels become especially vulnerable after age 60. The repeated strain results in micro-tears and inflammation within the vascular tissue. Over time, the walls of these vessels harden, impairing their ability to expand and transport blood. The result is a slow, imperceptible form of strangulation. The arteries that once provided robust circulation now struggle to supply enough blood for even a partial erection. What most men don't realize is that this decline does not occur instantly. It creeps up on you. One day you notice it takes longer to become aroused. Another day you sense that the feeling isn't quite what it used to be. Eventually blood won't fill the chambers as it once did. You attribute it to aging, but that's only part of the truth. The reality is a gradual deterioration of vascular health stemming from how you've stimulated yourself over the years. I once had a 67-year-old patient who thought he needed testosterone therapy, but upon further examination, his levels were normal. What we discovered was scar-like thickening in the tissues surrounding his erectile chambers. The cause: years of overly vigorous self-pleasure had physically altered his sexual function. The unfortunate part is that it could have been avoided with a little awareness. This kind of pressure doesn't just harm circulation, it dulls sensitivity. Nerve endings become less responsive, prompting men to grip even tighter to feel something, perpetuating the cycle of damage. It impacts more than just your body. It erodes your confidence, intimacy, and connection with your partner. You stop initiating intimacy and emotionally withdraw. The damage is not merely physical, it's deeply personal. If this resonates with you, it's not too late. You can retrain your body, employ a gentler touch, rediscover sensation over force. Most importantly, Honor your body's current needs, not what it could endure decades ago. Treat your penis as a part of you that warrants care, attention, and patience, rather than an object to conquer. This small shift can make a significant difference between fading intimacy and renewed connection. Now, here's something even more concerning. The way you masturbate isn't the only risk factor. In fact, neglecting to use lubrication during those private moments may be causing just as much harm. Many men overlook this and pay a steep price. Secret 2. Masturbating without lubrication. The silent skin destroyer. Let me ask you a question that many doctors might avoid. When was the last time you used lubrication during self-pleasure? For numerous men over 60, the answer is either never or I didn't think it was necessary. And that's where the danger begins. Imagine rubbing your hand briskly across dry skin for 30 seconds. Irritating, right? Now imagine doing that to the most sensitive part of your body, where the skin is thinner, more delicate, and heavily reliant on tiny blood vessels and nerves to function. That's what occurs every time you masturbate without lubrication. While it may seem trivial at the moment, this dry friction is one of the most underestimated threats to male intimacy as you age. When you stimulate yourself without lubrication, you create micro-tears in the penile skin. These small injuries may not bleed or sting, but they lead to long-term inflammation, scar tissue formation, and gradual narrowing of the capillary pathways that supply oxygen-rich blood to the penis. Over time, these minor traumas accumulate into more significant issues, restricted blood flow, diminished sensitivity, and a loss of fullness during erections. I've witnessed this firsthand with numerous patients. One 72-year-old man came to me disheartened by his declining intimacy. He said, "It feels like my body just doesn't want to respond anymore." He had no diabetes, didn't smoke, but when we examined the tissue, there was visible thinning of the skin and reduced elasticity, indicators of prolonged microdamage. He had been masturbating dry for over 40 years, completely unaware that he was gradually suffocating the very vessels that allowed him to experience pleasure initially. What troubled him most, and what I often have to gently explain, is that when scar tissue replaces soft tissue, the blood vessels lose their ability to expand as they once did. This results in less blood flowing in, less blood staying in, and the sensations you previously took for granted begin to fade. Your body starts to treat the area as a site of trauma. The damage becomes structural, and structural issues are far more challenging to reverse. However, it doesn't have to be this way. Using a quality water-based or silicone-based lubricant can significantly decrease friction, safeguard the skin barrier, and maintain the integrity of your circulatory system. Think of it as preventative care. Just as sunscreen protects your skin, lubricant protects your manhood. It's not merely about comfort, it's about function, vitality, and preserving what is essential as you grow older. And if you've never used lubrication before, it's not too late to start now. Your body is still capable of healing and improving if you provide it with the right conditions. Respecting your body isn't a sign of weakness. It's wisdom. But here's something even more unexpected. Even when men do everything else correctly, gentle grip, proper lubrication, the way they position their bodies during these moments could still be silently restricting circulation without them realizing it, with equally dangerous effects. Let me clarify. The Secret 3, poor posture. Why masturbating while sitting can hinder circulation. This might surprise you, but one of the most detrimental actions you can take for your sexual health after 60 doesn't involve your hands. It involves your posture. In fact, I've seen men lose years of intimacy simply due to how they sit. Most older men masturbate seated. It's convenient, private, and what they've always done. However, over time, this habit quietly constricts circulation to the pelvic area. When seated, particularly hunched over in a chair or curled up in bed, You exert direct pressure on the perineum, the area between the anus and scrotum. Most don't realize this region houses a vital network of arteries and nerves that supply blood to the penis. This pressure acts like a clamp, compressing those tiny blood vessels and squeezing the pudendal nerve. It's akin to trying to water your garden with a kinked hose. Regardless of the pressure, the flow is obstructed. This type of postural compression doesn't cause pain, which is why it often goes unnoticed for years. Yet, gradually, the tissue is deprived of oxygen, circulation slows, and sensation diminishes. I recall a 74-year-old man named Robert who came to me frustrated. Even with medication, his erections felt numb and weak. We analyzed everything: blood work, hormone levels, cardiovascular health, until he casually mentioned he always sat on the edge of his bed while pleasuring himself, hunched over for 20 to 30 minutes. That was the missing link. We conducted an ultrasound and identified signs of vascular congestion and diminished blood flow to the penis. His posture was the issue, not his hormones or heart, but the way he sat. This type of damage accumulates gradually. What begins as mild numbness can develop into incomplete erections. What starts as tingling can evolve into delayed arousal. Ultimately, many men may lose the capacity to maintain intimacy altogether, not due to aging, but because their pelvic blood flow has been silently restricted for too long. The truth that many won't admit is that sexual vitality relies on pelvic health. If you compromise that foundation, everything above it collapses. The pelvic region requires space, movement, and relief from pressure. The solution is straightforward but effective. Recline with support, open your hips, and avoid prolonged compression. Just as you wouldn't restrict blood flow to your legs for 30 minutes, don't do it to your most vital organ. You deserve better than to lose sensation and connection simply due to how you sit. A slight adjustment can lead to years of restored intimacy and function, and trust me, your future self will be grateful. But even posture isn't the complete picture. Sometimes the real damage arises not from how you sit or touch, but from how often you engage in these activities and how your body signals it's had enough. This is where most men become completely oblivious and pay the consequences. Let me clarify. Secret 4. Overstimulation and frequency, ignoring the body's natural signals. This may be hard for many men to accept, but I need to be clear. Sometimes the most significant harm comes not from a single act but from repeated actions without allowing your body time to recover. I'm referring to overstimulation. Masturbating too frequently, especially without acknowledging your body's need for rest, gradually undermines your vascular and sexual health. By the time you notice the damage, it has already taken root. I understand how it occurs. You retire, spend more time alone, seek comfort, release, or merely something to fill the silence. Masturbation may seem like a safe outlet, but without limits and awareness, it can become a slow poison. The body after 60 isn't designed for the rapid recovery it had in your 30s. Blood vessels are more delicate, the nervous system more reactive, and hormonal balance more sensitive to stress. Each time you climax, your body enters a temporary recovery phase called the refractory period. For younger men, this may last minutes, but for older men it can extend to hours or even days. If you push through this window too frequently, ignoring your body's natural breaks, you create a continuous cycle of overstimulation and inflammation. Blood vessels remain constricted, preventing the penis from receiving the oxygen required. For full recovery, in many cases, this leads to chronic pelvic congestion and nerve fatigue. I've seen men in their 60s and 70s who have gradually lost all sensitivity, not due to illness, but because they overexerted themselves too often for too long. The blood flow ceased to function as it should, nerves dulled, erections weakened, and intimacy faded into a distant memory. What makes this so perilous is that the damage often feels invisible initially. It hides behind the belief that more is better. However, what your body now needs is not more stimulation, but more respect. Each erection demands blood, oxygen, and neurological coordination. If you continuously deplete these systems without allowing time to recharge, the damage becomes cumulative and, in some cases, irreversible. This isn't about shame. It's about wisdom. Knowing when to stop is just as powerful as knowing how to start. I frequently advise older men to limit their frequency to 2 to 4 times a week, based on their energy, circulation, and recovery. Allow your body to heal. Let your desire return naturally rather than forcing it. The benefits include heightened sensitivity, stronger erections, and a renewed bond with your partner, both physically and emotionally. At the core of this, intimacy isn't solely about stimulation. It's about presence, awareness, and feeling more, not just doing more. If you give your body the space to breathe, it will astonish you with what it can still achieve, regardless of age. Now, you might be questioning whether these habits have already caused damage. Is it too late to reverse the effects? The answer is no. In fact, there are proven practical strategies that can help restore blood flow, enhance sensitivity, and revive areas that feel numb. Let me guide you through what truly works, the path to recovery, how to restore circulation, sensation, and intimacy after 60. I've shared a great deal with you today, and if any of it resonated with you, know that you're not alone, and it's not too late. Regardless of how long you've lived with these habits, your body still yearns to heal. Your blood still wants to flow. Your heart still craves connection. The path to recovery isn't complicated, but it does require intention and courage to change. Start by altering your perspective on self-pleasure. This isn't just a private act. It's part of your health routine. Use a gentle touch, not from weakness, but because your circulation relies on it. Generously apply lubrication as a daily act of care for the skin and blood vessels that sustain your intimacy. It may feel odd at first, but I assure you this step alone safeguards more than just your comfort. It preserves functionality. Next, change how you position yourself. Sit less, recline more, open your hips, and create space in your lower body so that the arteries and nerves in your pelvis can breathe again. Even a small pillow under your tailbone can make a significant difference. These might seem like minor adjustments, but collectively, they create a foundation for stronger, longer-lasting erections. Be mindful of how often you stimulate yourself. Set limits, not to restrict yourself, but to allow your body time to recover. 2 to 4 times a week is a healthy rhythm for most men over 60. Instead of pursuing intensity, seek presence. Take your time. Slow down. Breathe. Focus on sensation rather than release. You'll be amazed at how much more satisfying it becomes when you give your body space to feel again. In addition to technique, nourish your circulation daily. Walk more, stretch your hips and lower back, drink more water, and consume foods that support blood vessel health such as beets, berries, spinach, and fatty fish. Don't hesitate to consult a doctor if you're worried about blood flow, numbness, or changes in function. Seeking help isn't a sign of weakness. It's a demonstration that you still care about living fully. Lastly, forgive yourself. Many of the habits we discussed today weren't taught to you. You did what you believed was normal and felt right at the time. But now you know better. Now you have the opportunity to make different choices, which can restore more than just physical health. It can revive confidence, connection, and even joy. You're not too old. You're not broken. You're not finished. This is your opportunity to reclaim what matters. Every step you take, every change you implement can bring more life, sensation, and closeness into the years ahead. If you're still watching and ready to embark on this journey, please let me know by typing "I'm ready" in the comments. Remember, sometimes the smallest changes yield the greatest breakthroughs. This isn't the conclusion. It's the start of something much better. If you're prepared to regain control, subscribe and type "I'm ready" in the comments. Your comeback begins now.